Welcome back to Health Matters, brought to you by CIPLA. I'm your host, Ryan O'Connor. Now, your health obviously is your greatest asset, and small changes can make a huge difference. In this podcast, we're going to break down simple, practical steps to help you invest in your well-being. From making the most out of your pharmacy visits to preparing for a specialist appointment, we'll also explore what it really means to live a healthy life, and of course, how to take control of your health. That's the most important. Whether you're looking at or looking for everyday wellness tips or expert insights, Health Matters is here to help you. So let's get started. And this week we are joined by Dr. William Kleynhans, a highly experienced medical advisor at CIPLA, and of course, as we all know, a global leader in pharmaceutical and medical devices. Nearly 20 years of experience across Europe, South Africa, and Southeast Asia. Dr. Kleynhans is a recognized expert in digital healthcare. His work has played a key role in driving digital transformation, of course, telehealth, advancements, and AI-powered healthcare solutions. So currently pursuing a MPHL or MPhil, am I right in saying that?
Yeah, my master's
MPhil in occupational health. He's also got a strong personal interest in AI and algorithmic risk management. Now, if that sounds like a lot, we're going to dive into all of that. We're excited to have you on the podcast today, on the show.
Oh, thank you very much, Ryan. Looking forward to it.
Now, how to think about living a healthy life? I mean, where do we begin?
Ryan, I think we wanted to use this opportunity to really delve into health matters.
Yes.
And the conversation started with, helping people understand that you should make your own health matter.
Sure.
And that's really where we start, is taking a little bit of time to put your own health first. Because we see it a lot. Mums are looking after kids. Dads are looking after their kids.
Yes.
Maybe work comes first. And just making that mind switch. We say, I'm going to spend a little bit of time, sit down and start doing a little bit of planning. Makes a big difference.
Yes.
We tend to engage with our health when when things are on fire, when you're sick, when your kids are sick.
Yeah.
And we've learned so much that a little bit of proactivity makes a massive change, not only to your quality of life,
Sure,
but stress in your life.
Absolutely. Let's talk about those simple steps. What are the simple steps we can take to invest in your health?
So, step one, have a game plan.
Got you.
Okay. Step two, understand where you are at which stage in your life. So, I myself, I'm coming close to 50. There's a couple of things that I need to look after. I've got to monitor some screening stuff, got to make sure that my cholesterol levels and my heart is fine. So step one, after you've put yourself first, understanding where you are at that stage in your life, is then to say, what's my game plan? So let's just break it down simply. For kids, straightforward. Helping them get into that opportunity of not getting the diseases of childhood. We always advocate vaccination, making sure that they're healthy and they get the nutritional supplements and the healthy food that they get. Then in teenagers, it gets a little bit more complicated. And that age group, we want to really invest in mental health, the growth and the support of that. Because remember, mental health is also part of your health.
Absolutely.
As you start getting into your 20s, that group, we want to really say, okay, start building that investment fund of health. So have a healthy lifestyle. Learn what it means, understand what it means to save a little bit of money for that rainy day, or have a health insurance or a medical aid to cover you when things go wrong. But simple things. Invest in your diet, invest in exercise.
Yes.
Then as you start getting into your 30s and a little bit later, maybe the odd niggle happens, maybe you've had the odd injury. That's when you really want to start that habit of an annual health screening.
Yes.
And health screenings are fantastic. Most schemes these days, make it very available. But we've got fantastic pharmacies in South Africa that offer really affordable services. Just check your blood pressure, check your sugar.
Yes.
Now, a lot of people say, look, I'm 30, what do I care? The fact of the matter is, if you know your basic numbers, then you're going to start to know when things go wrong.
Got you.
And those are really the 3 steps. Pharmacist can give you some advice. Sure. There's lots of general practitioners. And there's some really good advice on kind of how you build that health plan and what screening is worthwhile doing.
Now, a lot of people would say it's a simple thing to go to a pharmacy, right, and get medication. You walk in the door, but when you do walk in the door, you are overwhelmed by endless possibilities. Is there a right way in visiting a pharmacy for medication? Obviously, the first point of call is going to go and see if the pharmacist is on duty and explaining if the symptoms can be treated by the pharmacist. Obviously, if it needs a bit more specialist medication, you go and seek a professional. But how do you go visit a pharmacy, and how do you make the right choice when it comes to your own and your kids' medication?
And that's such a challenge. Most people's exposure to pharmacies are initially when things go wrong.
Sure.
You know, that 3:00 in the morning, the kids throwing up. You know that feeling.
Absolutely.
You got some coughing going on at home. Maybe you yourself feel unwell. It was a very long work weekend with a lot of late night work meetings. I got a bit of tummy burn. So I usually tell people the following principle. The nice thing is there's experts there that can advise you. But a simple rule of thumb is to say, am I here to control symptoms, or am I here to get a diagnosis? In other words, understand what's wrong.
Got you.
Or am I here to just investigate the stuff? Remember, we spoke about putting your health first,
Yes.
that kind of making your health
Got
matters. So am I here to investigate what's available?
Sure.
You know, what vitamins are available? What supplementation is available?
Absolutely.
Stuff like probiotics, all that stuff you can invest. Yes. So now you know why you're there. So most people, as I said, the first case, they're there because really they want to control some symptoms. And when you start thinking about controlling symptoms, the most common things happen commonly.
Sure.
You're coughing, you got a runny nose, you got a sore throat, maybe tummy's doing a bit of running, or the tummy's not doing a bit of running,
Got you.
which is also a challenge. And then obviously you have the other symptoms. So in that scenario, you'll usually find that most pharmacies are laid out in a way where the things that help you with those symptoms are together.
Yes.
All right. And that's where we say, go and investigate that. If you don't understand anything that's available there, ask the pharmacist, ask the assistant, say, listen, I got these symptoms. How do I control them?
Got you.
Okay. Also, that's where you can put a little bit of faith on a company like CIPLA, because we spend a lot of time making sure that what you get for those symptoms really respond, and it's safe, and we invest in the manufacturing process all the way through to the quality process so that you get that symptom control at that stage. Now, I get this a lot. I've done a lot of emergency medicine work, but how do I know if it's serious or not?
Yes.
Okay. The nice thing is, again, the pharmacist can help you make that decision. If you feel like you're not winning with the symptoms, in other words, you've bought some stuff, that really then needs someone else to say, okay, let's investigate and make a diagnosis. Because a cough and a cold isn't always a diagnosis. A sore throat isn't a diagnosis. Yeah. So that's when you go use a doctor.
Sure.
All right, and the doctor helps you, or in South Africa, we've got also primary care nurses. I know some of the pharmacists have them to say, listen, let's look at the back of your throat. It's red, or there's all kinds of mucky stuff at the back.
Sure.
This is a tonsillitis.
Got you.
You're going to need that antibiotics.
Yes.
So that's when you help with the diagnosis. And then we spoke about the third part is understanding. So that's the great thing about the Health Matters service. Sure. If you listen to some of the past podcasts, there's some great advice on this works for that works for mental, this is for your joints, etc. And that's a really, really powerful tool for you to use. And we're constantly expanding the advice around a more well-being, healthy lifestyle.
Got you. Now let's move out of the pharmacy. Now we find that we've got to go and see a specialist, right? And when we hear the name specialist, we think, okay, I'm going to arrive and this is a person who's going to tell me everything and do everything for me. I'm just going to come along basically as a spectator with said ailment, and the specialist will do what the specialist does. But often we don't maximize that visit. We don't maximize a visit to a specialist. How do we get the most out of that visit to a specialist?
Yeah. Ryan, that's an excellent question. And the way that you're talking, it sounds like you've had some personal fun 100%. Experiences. And so it's also so useful to understand how the whole doctor setup works. So you've got general practitioners, okay, and they are for looking after you. Most conditions, they can see anything, treat anything. But then there are doctors who spend their time, and you get two groups. The one group spend a lot of time studying more disease of the body and listening, and another group study how you do surgery for that. Okay. So those are what we call specialists.
Right.
So immediately you know they're not going to solve all your general problems. They're going to be very focused on what they're really good at.
Yes.
And the funny thing is, people forget that they say, oh, but he's a doctor, he's supposed to sort that out. But the reality is these guys, after a while, only really know what they know there. And what I hear a lot, and I hear this a lot from people who are a little bit older as well, that they had a visit to the specialist and they walk out of there and really it wasn't a fantastic experience. Okay. So we want you to get the most out of it. But also that information is the thing that will make your health matter.
Yes.
Okay. And have those changes and help you make decisions. So first step, before you go, understand why you're going. What information you want to get out of that visit for yourself and why you were sent there. Okay. Now you got the time, you're going in there. What I always say to people is, when you're having that conversation with someone, especially you don't go see a specialist for simple reasons. It's usually been something that's been coming for a while.
Yes.
So it's overwhelming, you're emotionally overwhelmed. And that's where that list of questions is so vital for you to go there. Make sure you get all your questions answered in a way that you understand it. So sit down, he'll explain stuff. If they are curt or short with you, that's their problem. Okay? It's very important for you to really cover all those things and get the insights so that you can walk out feeling, okay, I now kind of know where I'm going.
Yes.
Don't make it 100 questions. Be reasonable.
Yes, the doctor's only got a certain amount of time. You're not the whole day.
Well, you do find guys that spend some more time. But also what you'll end up doing is getting little bits of information, not proper answers on the question.
Got you.
And then how doctors are trained is they examine you, check you out, and then they come up with a plan. And a lot of the time the doctor will actually write the plan down.
Yes.
Make sure that you get a copy of that plan. Write it down. Like the plan is we're going to send you for this, and based on what we know from that, we're going to do this, and then we're booking you, etc. So getting those answers, really important. Now the final thing is, and this is a neat little trick that I can advise everyone that try and have a family medical group. And just before you walk out, if it's a internal medicine specialist, you're going to get a long prescription. You might get some other stuff. Take a photo of that prescription and put it on the family group as a record. Take a photo of any letters or referrals. Then you got a record. You can't lose the stuff. Everybody else has got access. And we're now, and I don't know about you, but I'm at that stage where my parents are reaching the age that sometimes I have to kind of be involved or also chat to other guys. This way I know what's going on. I can share it with the doctor. I can show it. Just make sure that the privacy is just in the family. But it just allows everybody to kind of understand. And sometimes, sadly, things go wrong in the middle of the night. You end up in the emergency department.
You've got everything.
You've got the records.
I love it. It's so clever.
Yeah. And simple, straightforward. Everybody's WhatsApp comfortable these days.
I love that. Listen, we haven't even begun diving into AI and the whole other side that I love to talk about as well. So we will be back with you without a doubt, because there's so much we still need to discover, and the way technology is moving now, we visit to certain doctors or those checkups that we refer to in this podcast. There's now devices doing it for us 24/7, 365, which can be very addictive, but also it can be really good for our health. So looking forward to having you back on the podcast, Doc, because there's lots to delve into, especially in that space. And it's an interesting space in 2025 because it's the evolution of the space is one that's an ongoing thing, and it'd be lovely to have you back and touch on those certain touch points.
Absolutely. I really look forward to it. So many people are walking around with wearables.
100%.
And I can promise you 90% of people aren't getting the full value.
No, got
and
you.
we'll start there and we'll work our way up the technology chain.
These are reasons why you like, you subscribe, and you watch Health Matters. And in this episode, Dr. William Kleynhans, who's been exceptionally informative in terms of what we've needed to cover in this episode, but we will be back with him to pick his brain in that AI space and technology that's now available to help your life and your health matter. Remember, like I said, like, subscribe. It's proudly brought to you by CIPLA. We're on YouTube. Some of the most popular episodes are there as well. That's Health Matters SA on YouTube. Go check it out, and we'll be back with another one soon.